1,000 words.
Oh, it does. Oh, it's easy to cut this one off, it's so big.
Yeah. One thing I'm allowed to do is to tell large nose jokes. Get you just pull that a little bit to the sides, just super. Because I know we want to do something with that, so which we can. Brilliant. I'll go and get those going.
Okay, I'm here now with Dr. Leet. I've just had my pre-makeover photos taken so they can actually now put them up on the screen, get an idea of what's happening. Dr. Leet has been in the cosmetic business now, specialising for about 15 years, but he's been in the medical industry for about 29 years. His whole team regularly attend a lot of conferences and lectures to make sure they're up with the latest and greatest in everything you could possibly need. The best thing about this boutique clinic is that everything they do is non-surgical. So girls, everything that you could possibly want, from anything from a non-surgical facelift, a non-surgical nose job, hint hint, and also they'll do micropeels, anti-aging treatments, dermal fillers, absolutely everything you could possibly want. So what I'll do now, I'll just let Dr. Leet go on and do the consultation, and we'll see exactly what he thinks that I might possibly need.
First of all, have a look in the mirror and tell me what it is that you don't like, what it is you'd like to change, or what your thoughts
all of this.
Right.
Okay, I suppose the worst things actually that I don't like at the moment, I've always had very deep lines on my forehead.
Right.
Misspent youth, 6 days a week of sport out in the sun, water skiing and things, so I've got a lot of sun damage. But the lines through here really bother me, the pigmentation, the freckles. Yes. Through here I've got a lot of slackening around this area here, especially for some reason, just on one side I've got a lot of lines. I've never been a smoker, but I've got a lot of lines through here and a little scar here from where I was attacked by a wild cat when I was a child.
Right.
And of course the eyes, the wrinkles around the eyes do really bother me as well.
Okay, alright. So, I mean, what I would say initially looking at your face is that the nice thing is you've got really nice volume in your cheeks still. So with a lot of patients, as they get older, especially patients like yourself who are fairly slim, they tend to age and they lose volume in the face. And the nice thing with your face is you've still got really nice sort of volume in the cheekbones, strong cheekbones there. You've got good volume in your temples as well. A lot of people get really quite sunken in their temples, and they don't, it's not a thing that people sort of notice. Specifically about their face, but it's a very aging thing, and so with a lot of people the first thing that we need to do is to really sort of put that youthful volume back into the cheeks and the temples, but in a natural way, not in an overdone way. So the nice thing is that we don't need to do that with you, which is great. Definitely the skin is a big thing.
Yes.
And we know when we, from studies that have been done, that if you clean up the sort of sun damage in the complexion, you make people look significantly younger. So they've done some very clever studies where they've sort of morphed different people's skin of different sort of stages of sun damage and age onto the same facial features. And what they've shown is that if you clean that sun, if you don't have that sun damage there, people actually look 5 or 10 or more years younger. So cleaning up the skin is definitely a big thing. And the nice thing is that we can do your neck and we can do the chest and we can do all of that quite simply. So yeah, that's a very big thing. So essentially what I can see that we'd like to do, clean up the skin. As you say, sort of improve some of the lines and wrinkles on the forehead and around the eye. Probably at the same time we can give a very little sort of lift and open up the eyes that little bit. And then, as you say, a little bit of volume sort of underneath the eyes there where it's getting a little bit tired looking. So you don't look tired all the time. And as you say, sort of a little bit in the lips around here. So nothing sort of major. It's all just tweaking. And basically, what we're trying to do nowadays is just to really sort of highlight and bring out the best of your natural beauty and highlight it and just sort of little things to bring that out.
Yes.
So if you can make a nose smaller. What we can do, and it's quite a simple thing nowadays, is to make noses straighter and give them a better sort of proportion and even out any irregularities really quite easily with the fillers that we have now.
That's brilliant.
And so although it's not actually making the nose smaller, it can sometimes make it appear smaller.
Yes.
And certainly more refined. It's a side of your face that most people don't see themselves.
No, that's almost scary.
Yeah. So yes, with the nose, we can put a little bit of volume in this part here, and it will tend to make it look much straighter. And maybe a little bit of volume around the top part here, and it will actually often look a little bit, sometimes look a little bit smaller and more refined. So quite a good way to look at the face is actually to look at it in thirds. What we can do is sort of look at the top third of the face there and say, okay, we probably want a little bit more lift in the eyebrows. We probably want, as you say, a little bit of improvement in the lines there on the forehead. If we look at the middle part of the face, we can say we want that little bit of volume sort of right underneath the eyes, and maybe a little sort of highlight of volume on the cheek, not a lot, but just to sort of bring out the cheek that little bit. It's little things that make a big difference, you know. So ideally what we want people to do is to look at you and go, wow, you look great, you look like you've had a great holiday, but not be able to sort of pick out, oh, you've had this done or that done.
Yes.
And often when we look at a photograph of a before and after now, you're sort of hard pressed to really sort of pick what's been done, but you can just look at it and go, okay, yeah, I can see that's a younger version, a younger looking version.
We like younger. Younger is good, we like that word.
Yeah. So good volume in the cheeks. We want to do something a little bit with the nose, a little bit with underneath the eyes here, obviously the skin.
Yes.
And then the lower face here, as you say, a little bit sort of just enhance or define the top lip. A little bit of treatment on the little tiny lines on the top lip there, and maybe just around the corner or along the jawline. But we don't need to do too much anywhere, which is nice.
Oh, that's good.
Should be all very easy stuff to do, really.
Fantastic. So when you did the overall skin treatments as well, I'm presuming that's going to not only just help with pigmentation, but also the pore size as well, because as we get older, our pores do tend to enlarge quite a bit, especially around the nose area.
It can do, yes. And pores are one of those things that are actually quite a hard thing to improve, often. So some of the treatments that we do and some of the treatments that we'll be doing for you will probably improve them. The other thing that we haven't sort of discussed and that I often sort of do towards the end is skincare.
Yes.
So there is some skincare around now that's very, very anti-aging and can certainly help with things like pores.
Wonderful.
So when we've sort of cleaned the skin up, done a few of the other little things that we want to do, we'll have we'll have an appointment together and we'll just sort of go through what you can do with skincare that's truly anti-aging.
That's fantastic. It's like a complete program right the way through. That's wonderful. Oh dear.
So it's a before picture, so before pictures are allowed not to look good. So we can do things pretty much in any order that we want to do them. What I like to do first is to do an IPL treatment or something to clean the skin up.
Yes.
So when we come to cleaning up the skin, if we're looking at really effective treatments, we've got two options. One is to do an IPL treatment, intense pulse light,
Yes.
and the other is to do what I call a laser peel.
Oh, yes.
So we can do like a modern fractionated CO2 laser, and it does a sort of very full sort of peel of the skin.
Yes.
The difference between the two basically are, with the IPL, you'll get a very good result with that.
Yes.
It might not get rid of every bit of pigment,
Mm-hmm.
but it will make a huge improvement. Safe to do on the neck and the chest and the hands and everywhere.
Wonderful.
And very, very little or nothing much in the way of downtime afterwards,
Okay.
and very, very safe.
Mm-hmm.
With the laser peel, you've got a lot more downtime afterwards,
Yes.
so you really do peel with it,
Mm-hmm.
and you're basically stuck at home for a week or so. So
Yes.
it's a much more intense treatment.
Yes. The results, the difference between the two results with them?
Well, I think the laser peel can give certainly better results
Yes.
for sort of pigment problems.
Mm-hmm.
The benefit of IPL is that it really does treat redness and blood vessels on the skin as well as pigment.
Yes.
My personal feeling for you is that you'd get a great result with the IPL, and I'll probably tend to do that.
Yes.
We can always do a little bit of the laser afterwards if we don't find that we get quite the result that we want
Sounds
with the
good, so you
IPL.
can do
I think
both
that
if you need to.
We could do both.
Terrific.
So essentially with the IPL, how we do it here is we try and get a result with one treatment rather than doing multiple treatments.
That's very good.
The way that it works is we get you to come in here, we put some anaesthetic cream on your face for about half an hour, and you can just sit and have a cup of coffee, and then we do the treatment. Treatment takes about 15 minutes. It feels a little bit hot and stingy as we go over your face with it, but with the anaesthetic cream, most people find it's very bearable, it's not a problem at all. Afterwards, you tend to look a bit red and sunburnt and feel a bit hot and sunburnt for anywhere from an hour to a couple of days. Some people, and from research that I've done on my patients, it's probably as high as about 4 out of 10 people will get some swelling or puffiness in the face.
Yes.
But it's usually pretty minimal, and it generally doesn't last more than a couple of days or so. The main thing that you'll notice is all of the pigment on your face, and there's a lot more there than you realise, will go quite dark.
Yes.
And sometimes it goes a little bit dark, and sometimes it can go quite black. It's very variable from person to person. Okay. You can put makeup on. Most people find that they can put makeup on and go about all their normal activities. But some people find that it's a little bit dark and hard to cover with makeup. Most people don't have a problem with that. And that takes on the face, that lasts about a week.
Yes.
And after a week, that's pretty much cleaned off. So the pigment goes dark, comes up to the surface. We call it miloing because it often looks like someone sprinkled a little bit of Milo on the face. And then it doesn't peel off, it just sort of flakes or fades away off the surface. And we generally get people back at about a week, and we do a little peel or microdermabrasion just to help the last bits come off.
Is it alright to exfoliate in between, or is it best just to use a gentle cleanser?
Just a gentle cleanser, and just be very sensible with the sun. So sunscreen,
absolutely,
that sort of thing.
Yes.
But you don't have to be neurotic about it. We can just do your face, or we can do the face, the neck, the chest and the hands all in one go.
Oh, yes.
You know, I don't mind, it's up to you. Some people like to just see how it goes on one area before they do the rest, and other people go, I'd like to get it over and done.
Oh, yeah, look, we're jumping into this entire makeover, so we might as well go the whole hog to start with.
Oh,
yes, no pain, no gain.
Yeah. So what I'd like to do, book you in, and we'll do the IPL first.
Fantastic.
And then we'll probably, the second step, as it were, would be to do a little bit of the dermal fillers, and we'll talk about that in a bit more detail then. And then the third step would probably be to do what's called a neuromodulator or some botulinum.
Right.
So the two products that we have available in Australia at the moment for that are Botox and Dysport. We can use either of those. And then we'll probably talk about skincare, but we'll probably be largely there, but we'll take it step by step, and we can change things or as we go and decide a different route if we want to. Okay.
That sounds fantastic. Thank you
All
very
right.
much, Dr. Lee.
Okay,
Wonderful.
not a problem. We'll make a time.
We're on our way.
And they've treated several hundred patients with Dysport, and then they've reported every side effect that those patients had reported. So obviously if someone happened to have a flu soon after they had the Dysport, that was put down as a side effect.
Yes.
So in actual fact, it's incredibly safe, and I'll go over the side effects that can occur near the time, but just don't be put off too much by the detail.
Yes, I suppose they've got to cover themselves too, don't they?
With regards to fillers, what we call fillers, where we want to give volume or treat lines and wrinkles, we've now got a really huge variety available.
Yes.
And nothing like the variety that they've got in Europe, but we've still got a big variety available here. It's rather different from sort of 16 years ago when I started doing this, when all we had was collagen. It's really easy, So someone came in, what can I do? Oh, collagen.
Yes.
If all you've got is a hammer, everything looks like a nail. Nowadays we've got a number of different products, but probably the products that we'd be looking at using would be things like Restylane, Juvederm, those types of products. Yes. So there's some information on those here as well. So this is what we're sort of looking at for adding the little bits of volume and treating lines and wrinkles when we want to do that. So I'll let you have those.
Thank you very much.
You can have a read through those. Obviously, if you've got any questions at all, more than happy for you to contact me at any time.
Thank you. That's terrific.
Okay.
Thanks.
Awesome.
Very good.